glucosamine and potassium. So within the glucosamine sulfate potassium chloride, we have glucosamine, which is 500 milligrams, and then the potassium chloride, which is 167. So you combine the 500 and the 1667 to give us the 667. Are you getting it? But they are saying if you have a kidney problem or you are taking heart or blood pressure medications, please first consult the doctor because of the potassium there. So you may find someone is on potassium sparing medication, and maybe when you check his potassium levels are high, they're above. Potassium is hyperkalemia is bad. Are you getting it? So when you decide to initiate giving Naflam, you have to be careful because of that potassium which is there. I'm sorry, I've not yet gone why they are combining glucosamine with potassium. Maybe to improve absorption, but I'll find out why. Maybe it's the salt form of it, but why would it be? Because we have the sulfate on it. But I'll find out why they're combining glucosamine with potassium chloride. We have the shark chondroitin. By the chondroitin, they get it from the shark. That one, they bring it and they add it. That's how they make products. So imagine Naflam, glucosamine, chondroitin. Also glucosamine, chondroitin. So the other one adds in some minerals in it, manganese, calcium carbonate. Osteomine, glucosamine, chondroitin. Osteomine tablets, glucosamine, chondroitin. We also have diacerin. Diacerin is there 50 milligrams, which is anthraquinone class. But that is 50 milligrams once daily with evening meal for the first 2 to 4 weeks. Then you switch to 50 milligrams twice a day. So you first give it once a day, diacerin. Then for the weeks that I've said, then you switch to 50 milligrams twice a day. That's how it is. So it's not recommended in patients age 65 due to complications of diarrhea. Diacerin has some problem of diarrhea, which is the same problem up here with the Ricard. So those are the few products I got at Zest. The Ricard is the most I would like. I loved it. Mnemonic C, just that one, you can think and also set up something of your own. By the way, it doesn't that maybe you reach there and you retire early as you have your product. We have Catilamine. They just combine these supplements. They're just components of the cat. So that's how they manage osteoarthritis. You find it out, give acetaminophen, rule out liver, turn to NSAIDs, turn to tramadol, turn to intrarticular injections. If we have intrarticular hyaluronic acid, give there. Maybe surgery, then add on supplements. It does not refuse. So for us at Zest, if we find out, you can give naproxen tablets. After you can give the supplement, it is okay. But if I send someone to the lab, I think that's it. We also have the cream, the topical supplements. I think I've forgotten. I think, is it Osteocare? Which has glucosamine in it. It's a tube. I think it's 45,000. Just apply it topically if someone doesn't want to be taking tablets. But it is also there. But there are so many products. But overall, these people are just concentrating on the components of the cattle. The other than we add the collagen and something like that. So that's about osteoarthritis. Let me see. Because of time, I'm not going to talk about Gunde. Because of time has gone. I think I've overspoken. I'm very sorry for that. Not giving other members time. That's how rheumatoid looks like. This is how the structure of the joint looks like. The healthy one, the non-healthy one, it is there. You have seen the subchondral bone, it is there. It is used to nourish the cartilage. You have seen the bursa. When it's inflamed, you have it, bursitis, tendinitis, tendon getting bichi. So you can see this is what we call Bouchard and Haberdini's nodes. If I remember talking about them, those are the ones, those joints of the fingers. So sometimes you may find them dislocated, very crooked, unless it is in a straight line. Those are what we call Bouchard and Haberdini's nodes. So you can see that is inflammation. That's why I told you to prove that someone is having inflammation. That's how it is. So for next time, I'm not going to. These are the diagnostic criteria for rheumatoid arthritis. We also do erythrocyte segmentation rate, rheumatoid factor, they talked about it. Pathophysiology was autoimmune, it was talked about. Non-pharmacological. For the DMARDs, we have, I think as this, we have hydroxychloroquine. These are just to steady state, followed by 20 milligrams once daily. Hydroxychloroquine is the same. You give 200 milligrams BD or 400 milligrams daily. It is safe in pregnancy, hydroxychloroquine. Yes. Leflunomide, we have it there. Each tablet of leflunomide is, I think, 1,000. I've forgotten. We have sulfasalazine. Minocycline, we don't have it. I didn't talk about biological agents because of that. For here, the corticosteroid therapy, the PRID, because we need a steroid because of the immunosuppressive properties they have, but we give it at low dose. Remember, we are giving for a long time. If you decide to give prednisolone, you can give 5 milligrams once in the morning and the evening, or you can give 2.5 in the morning and 2.5 in the, see, 2 times 2, which is 10 milligrams in the morning. How long are you giving the steroid? Remember, the long-term side effects of steroids are the weight gain, osteoporosis. We have it there, so you have to be careful when you're giving osteoporosis. That's how it is. We have steroid-induced osteoporosis. Yes, there's bone breakdown. That's why when our patient abajja nnyo ku zesti njagala dexa gwe mmira mponye senyiga biki biki, you tell them about the side effects by that. Weight gain, diabetes, hypertension, impaired wound healing and infection, because immune suppression. That's why impaired wound healing and infections can come in. Are you getting it? Osteoporosis is also there. But it's the most significant. Osteoporosis and weight gain, they are the ones. Yeah? So monitoring parameter, if you have decided to give Gundi a steroid, before initiating long-term steroid therapy, prednisolone 10 milligrams 6 months, bone mineral density should be evaluated. It is hard. I don't think they do it. These people just give. That's why when you're giving, so you can give a DMARD, hydroxychloroquine or leflunomide, you add on PRID. You have to, after like 6 months, you can add on these biphosphonates. Are you getting it? Eh? They prevent corticosteroid-induced bone loss. We have alendronic acid there. I think we have it. So after 6 months, you can switch those people who are giving a alendronic acid. They can give the supplements of calcium. We have Meditro there, vitamin D, calcium. I think we have all supplements of calcium can come in after a long time when you have seen that the steroid is going to cause long-term side effects of osteoporosis. So I think that's it on rheumatoid arthritis. For others, ankylosing spondylitis, that is backbone, that is back pain, sorry. That is back pain, but it can be other causes. It can be spasms, it can be stenosis. Yeah. So you have to rule out, but they're all the same. You give a painkiller, you add on, you give supplements. I've talked about. That's it. I think that's what I can give today. Thank you so much for listening to me.